My name is Emma. I'm a cardiac physiologist or cardiac scientist, which is part of the umbrella of healthcare scientists, and I work in the cardiology outpatients department here at Queen Alexandra Hospital. It's really nice having those patients in that room for those 30 minutes. Quite often, that's the most patient contact anybody can get in their job. Nurses sometimes are so pushed for time, they're in and out. And actually, what you tend to find with a patient is having somebody in one room for that amount of time, you actually get a bit of a quite good rapport with them. Some patients you'll see every 3 months or 6 months because you're keeping an eye on a certain pathology, you're diagnosing pathologies, but you're also monitoring them. So you'll see a lot of surveillance work and repeat work. It's actually really nice to see the patients come back time after time and hopefully improving time after time. Either way, you're there as a really important point of contact for these patients. So they get to know you really well and you get to know them well too. And the job's really nice because once you get into it, you can do as many master's modules as you want. You can do PhDs as well. And it depends how you get into it as to where you are on that front. So the kind of tests we do split into 3. So for patient tests, we have electrocardiography or electrophysiology. That's very much looking at the rate and rhythm of the heart. Is it fast, slow, regular, irregular? Diagnosing conditions with lots of kit for these people to try and find a reason for their symptoms, and then we can control or cure those symptoms. We have the kind of mechanical aspect, which would be echocardiography, which is ultrasound scans of the heart, and that looks at the mechanical structures, the chambers of the heart, the valves, diagnoses people with heart murmurs, heart failures, and a whole lot of other stuff in between. Then you have more of the plumbing side of it, which would be things like angiograms. So this is where we actually look at the blood supply to the heart muscle using X-rays and radio-opaque dye to find if there's any narrowings or blocked arteries that would be causing people to have angina, chest discomfort, or heart attacks.